come in.
Hi, Mr. Jones. I'm Victoria, and I'm part of the respiratory care program here at the hospital. Today, I'm here to show you how to use a dry powder inhaler your doctor's prescribed. Is that okay?
Yes.
All right. I'm going to go ahead and just wash my hands, and I'll be right back.
Okay.
Okay. Go ahead and put on some gloves. Okay, so your doctor's prescribed this for you in order to help you breathe a little bit easier. So before we get started, I just need to take your vitals and listen to your breath sounds, and then I'll go ahead and teach you how to use this, okay?
Okay.
All right. So first thing I'm going to do is take your vital signs. So I'll start with your pulse. I would also take your temperature and your blood pressure. And I'm just going to go ahead and listen to your breath sounds again. I'm just going to have you sit at the edge of your chair and breathe deeply through an open mouth, and just continue to do so. By doing this, I'm just listening to see if I hear any strange noises in your lungs. Sometimes that's the reason why your doctor prescribes you a dry powder inhaler, just to help with those lungs. Okay. All right. So I just want to double check what your doctor's ordered for you, and just one puff through this dry powder inhaler. So I'm going to go ahead and hand this to you. This is a discus form inhaler. And so the way that we use these is to first open it. You need to just hold this with the mouthpiece facing you. It's right there. Okay, and then you're going to slide the lever away as far as it goes until you hear a click. There, and that way you know it's ready to use. So the first thing that I need you to do is just hold that inhaler away from your mouth and take a deep breathe out as far as you can. And the reason you don't want that near you is because that powder can get stuck with the humidity from your breath. So once you have a full breath out, I'm going to have you place this mouthpiece right into your lips and get a nice firm closure on that, and breathe in steadily and deeply. There you go. Once you have a full inhalation, remove that from your mouth and hold your breath for about 10 seconds. That's going to allow that to really settle deep into your lungs. And then go ahead and breathe out slowly. Okay, and right here on this side, you're going to see this is a dose counter, and that's going to let you know how many treatments you have available. It'll go down each time you use it by 1. So that's a good way to know when it's going to be empty and you're going to need to have that refilled. So do you have any questions as to why your doctor prescribed this to you, or any questions about what's happening with this inhaler?
Nope.
All right. I just am going to have you, before you leave, try to cough for me if you can, see if you can get any stuff out. Okay. If you do get any stuff out, I'm going to take that and examine that for viscosity and color. And when we use inhalers and the corticosteroids, before you are all done, I need you to just rinse your mouth and spit that out, so that any of that inhalation medicine you used is out of your system. Perfect. Thank you. All right. And then before we're all done, I just need to take your vitals one more time and see if that treatment's working for you, or if we need to try something different, okay?
Okay.
All right, so I'm just going to go ahead and check your pulse again. Okay. I would also do your temperature and your blood pressure. And I'm going to listen to your lung sounds and see if they've improved since your treatment. So just continue to breathe out through an open mouth, nice and deep. right. Sounds like that's working for you. All right. Is there anything else I can do for you today? Any questions I can answer before you go?
Nope, I think you covered everything.
Okay, thank you very much.
Thank you.